My name is David Barrera. I'm the program director here at Care Integrated Behavioral Health. I've been here since its inception, and prior to that I was an employee of Christus Spohn here in behavioral medicine. I wanted this presentation, to put this presentation together to allow my staff to be heard, some of their concerns and their opinions. Some of them will be making comments about, keeping Memorial open. The reality is, we know this facility, this hospital building is scheduled for demolition, so it's going to come down eventually. But the importance is to having a facility in town. And I know that that's a discussion that's taking place as we speak, actually. But Dr. Perderio and Mr. Reddy, the owners of this company, they have been planning on a facility. I think it's important to mention that because it is the next step. Come August 15th, when the contract ends between Christus Spohn and Care Integrated Behavioral Health, there has to be a plan in place, and I know right now there's no discussion of that, at least not in public view. And I think that these are the kind of things that need to be discussed in public. I think it's important that the public knows that there is a plan for another facility, but it's going to take community leaders to come together to make that plan happen. This is the staff that's taking care of people on the front line. If we don't have a facility here in town, these patients are going to have to be transferred out of town to the Valley and to San Antonio. Families need to see their loved ones when they're in a psychiatric hospital and they're in crisis, and they need to visit with them. And most people cannot afford to be traveling to go see people for an hour and a half visit. The other issue I think is important is to mention there's a huge liability for having psychiatric patients waiting in emergency rooms, waiting on medical floors. My staff is and I like to brag about them, they're the best at moving those patients, at getting them moved. And I think that the Shoreline emergency room doctors and the staff there would agree to that. They've been witness to that, to seeing those patients be moved, to being evaluated, to being referred out to outpatient services. So I like to brag on my staff. I think we have the best staff at Care Integrated Behavioral Health. And I've been honored to be a part of choosing who those people are. When it comes to those patients sitting in emergency rooms, my heart goes out to those patients having to sit and wait in those wait times. But it also, I know that there's an important area of police, law enforcement that are sitting and bringing patients, and those patients need to be monitored, but they don't need to be monitored by law enforcement. Our ERs are not equipped to do that. And so many times law enforcement is going to be asked to sit and wait and monitor and hold those people. That's a real safety issue. I've lost friends in law enforcement over the years. I'm a former police officer that were killed in the line of duty. And I can tell you, an officer that's sitting on a patient waiting with them in a lobby in handcuffs could have been that officer that was a block away from helping another officer that was in a life-threatening situation. So I think that that's a discussion that needs to take place. And I know that law enforcement in town would appreciate that comment, and I think it's very important. So finally, I don't want to take up too much more time. I think that we have the best staff, and I know maybe every other hospital administrator would say that, but I'm on the floors. I'm evaluating patients alongside with them. I'm monitoring patients. I've been doing this a long time. 20 plus, almost 25 years dealing with this population of people. I've been working with Dr. Perderio for a long time. I know the importance of him being able to treat these geriatric patients especially. It's a very fragile population, and there needs to be a plan for those people come August 15th. And for these indigent people, the clinic card people are important too, but they're a very small portion of our population. Majority of our patients are truly indigent. They're insured, but they're sometimes underinsured, and they're our geriatric population. So I just urge you to listen to the voices of my staff and with an open heart, make the decisions that you know to be the right decisions. Thank you.
My name is Lena, and I am the program manager here at Care Integrated Behavioral Health. I have been in inpatient setting here at Spohn Memorial for the past 7 years. I even have an additional year of experience here as a student. And total time that I have spent in mental health, inpatient and outpatient, has been about 10 to 11 years. My position here as a program manager means that I actually oversee a lot of the operations and services that are provided on a day-to-day basis to patients, such as groups, interactions with families, ensuring that we're adhering to Medicare and the Texas Administrative Code guidelines, consulting with staff and patients on complex cases and helping them get resolved. I also do times work with individuals on a one-to-one basis when I am filling in for staff, whether it be in psychiatric evaluation services or on the unit. I also do oversee students that come in from Texas A&M University, Corpus Christi, and from Texas A&M Kingsville that are counseling student interns that I do provide supervision to, and that I have been doing consistently for the past 4 years. So in any given year, I have maybe 4 to 5 students that come through our program, shadow, work with our patients, and learn a lot from the staff that's here. We'll be without adequate inpatient resources in already an underserved community. We're putting them in a situation where they're already a disadvantaged population, a population that is already stigmatized because of their mental health issues, and basically saying, hey, you can't come here, go somewhere else, go to another city, or try to get insurance in order to get help. And putting those kind of ramifications on an individual really could deter them from getting the help that they need at that time. I have worked a lot with patients that have gone on to complete suicide, with families that have been affected by a completed suicide or been affected by a first-time psychotic break, not knowing what to do, not knowing where to go for help. And sometimes, outpatient services are just not fast enough. Hospitalization is required. And at that time, our staff here educates the families a lot on what your resources are, what kind of options you're looking at, where to get medication assistance, all those kinds of things that are really vital to our community. Because even if we do end up sending a lot of people out of town, they will come back to our community and they will be, poorly educated on resources here. I mean, if they're 3 or 4 hours away, how is that hospital supposed to know what kind of services are offered here in Nueces that can best support these individuals? And not every individual requires the same kind of care, requires the same kind of discharge plan. They're all very individualized. And I really think that in Nueces County that the need for inpatient mental health and adequate outpatient services are larger than it has ever been before. I feel that we're in a time where stress is chronic in our community. Stress is chronic on the day-to-day lives of people within our community. And I think that the last thing that, we need to see are an increase in number of completed suicides, increase in number of, homicides based, coming from people that are mentally ill that, could have not completed those acts had there been some kind of intervention for them. I also think that, law enforcement will be severely affected by not having Memorial Hospital, because they will have one less option for patients to go to. And I don't know if you've ever spoken to law enforcement before in our community, CCPD or Nueces County Sheriff's Department, but they have had some significant issues at other facilities other hospitals with taking in patients, getting patients admitted, and that's even for those that are under a mental health warrant. With that being said, I mean, I do have concerns about myself if Memorial closes. I feel like the experience that I've obtained all these years will not be utilized correctly within this community. I feel that services, quality of services will just not be there for patients and individuals. Memorial, the indigent population, geriatrics, and the severely mentally ill patients are all I've known for the past 7 years. It's what I love to do, what I enjoy doing. And with the closure of Memorial, I'll face a decision of having to, relocate and possibly take my skill set elsewhere, or, have to choose a different career path, one that I'd have to learn all over again and would not be something that I was already specialized in. So I really ask that, y'all consider not just, is this an issue of a contract or, who holds what influence over the community. It's really about the people, because they're the ones that live here, are here, and even if they're not directly affected by mental illness, a lot of people are indirectly affected by mental illness. The children of these adults, the children even not getting their parents not getting adequate services, or growing up in a system of a cycle that is not going to be broken. So I really do wish that Memorial would stay open. I would love to see our number of beds expand, not just for indigent populations, but for all populations. And I really think that this is a time for change to happen within mental health.
Hi, my name is Eileen. I am the Director of Social Services over at Spohn Memorial. I have been working in the field of mental health within this community for about 8 years now. Here we deal with a very particular special population. Most of our patients are indigent, uninsured, or the clinic card patients, some of course, but a lot of our patients are uninsured, which means of course they have a very vast lack of resources. They don't have money, jobs, social support systems, and of course already in this community we have very few resources for this particular population. And although we do have other inpatient psychiatric hospitals, they don't necessarily serve the same populations that we do here at Spohn Memorial. And if Memorial Psych is closed, these patients are going to have to travel far, to the Valley or San Antonio to receive inpatient psychiatric mental health services. And that is also just detrimental to them because they don't have supports available to them or the means to get back to this community after those hospitalizations. And I just feel like in this community there is such a vast lack of resources, and I don't feel like we should take away and continue to take away from the lack of the resources that we already have here in this community. And I ask this question: what is the alternative to closing Spohn Memorial? What is the benefit of it? The benefit is to who? It's not to the special population that we deal with. It sounds like it's really a benefit to money and corporations who are dealing with this population. I worked for Christus Spohn prior to working here, and I know that Christus Spohn's ministry, or not ministry, but they their mission is to extend the healing ministry of Jesus Christ. And I think that the population that we deal with needs the healing ministry from Jesus Christ more than anybody in this population. And I just think that we would be doing a disservice to this population, and we need to fill the gap until we can put something else in place. I want to say these things not to ruffle feathers, but to really advocate for people that we serve here, and be a voice for them, because they don't have that voice. And I just want everyone to really be aware of the disservice that we're going to be doing to this population.
Hi, my name is James Christopher Bowles. I go by Chris Bowles. My job title here at CIBH, I'm a mental health tech. I've been doing this for about 10 plus years. I started off at Northwest out there in Calallen. The first time I started doing this, I really had no idea of what I was getting myself into. It was kind of scary because I had heard about, the psych evaluation or the psych patients, stuff like that, and how some of them were kind of crazy. So I was kind of skeptical. But as I got a chance to work with them, I developed like a pattern of, hey, these guys need us here, and these guys need us to fend for them and provide services that are going to help them. With that being said, if you decide to take away what we're trying to do for these patients, it's gonna affect the population as far as putting these individuals out there on the streets with no place to go to, no help, no services, and not only that, but the crime rate's gonna go up. It's a sick population. And a lot of these guys do depend on us to care for them and to make sure we provide adequate services to them. This hospital has been around for a long time. CIBH has been here before I started, or Memorial has been here before I started. And we do what we can with what we have. And I think if you were to ask some of these patients, this place needs to be here. This place needs to function day in and day out. We need this place. We need this place for the patients. Not only so much for the patients, but for the staff. Whether or not we're closing, whether or not we're opening, I mean, it's kind of taking a toll on a lot of us, and it's kind of like nerve-wracking. I hope that you guys would sit down and think about continuing to provide services for these patients, continuing to let the staff do their job to help these patients, as well as help each other, as well as be a family, and continue to provide services. Please don't close us down, and don't do this to the patients. Thank you.
My name is Diane, and I'm a registered nurse. I have worked in behavior medicine for 7 years now. Prior to that, I was ICU, tele, Driscoll, PD-ICU. I was part of Christus when they had behavior medicine here. It was contracted out to CIBH, and I changed with that. My big concerns is I work mainly Gero Psych unit, and it's the geriatric patient I feel with the psych facilities closing that's going to be affected the most in our community. We deal with the Alzheimer's, dementia, people whose families are trying to manage them in the home until they get into a crisis situation. What happens when they get into a crisis situation? The police are called, and the majority of the time a mental health warrant is taken on these patients. If we don't have a facility like this, there's really nowhere to place them, especially if they're indigent. Bay Area does have a geriatric unit, but it does not care for the type of patients that we look after here. We've had several nurses that have gone to work there, and they tell me that it's a completely different population that they get. So the only alternative for the geriatric patient when they get in trouble is either to go to the Valley, to go to San Antonio, and to go to jail. which has happened with a 76-year-old patient we had about a year ago that ended up spending 2 days in jail, which was heartbreaking for someone that's confused, doesn't know which way is up. So my concern is for these patients, and if we do send them out of the area, how do their families keep in touch with them? How do they visit them? How do they keep that contact? Because a lot of the families aren't in a financial position to travel to these areas to check on their loved one. We also are dealing with the homeless and the geriatric population in the homeless as well. So to me, it's going to be a big loss to this community. We don't have the resources, and I feel that any city should have adequate psychiatric facilities for their residents here, and we're not a small city. So this is a big concern for me.
My name is Deb Allen. I am a CTRS, which translates into recreational therapist. I have a master's degree in therapeutic recreation. I've been here for 22 years. I've worked with the children when we had kids, with the adolescents, with the adults, and with the older folks. I've watched some of those children and adolescents become our adults. I've watched our adults grow older, because these are, in many cases, lifelong illnesses and conditions. I run into them in the community frequently, and they many times come up and tell me, I've been doing well, I've gotten a job, and it's very gratifying to see them doing well, and it makes me very happy. But other times I see them in the community and it's pretty obvious they are not doing well, that they're struggling. But I've always known that we were here if they needed us. And now I don't know what will happen to them if they need us. They aren't often people with a lot of options. And it's not just our patients themselves, it's their families. Mental illness impacts the whole family, their children, their parents. It can destroy families. I've always felt that we need to do more for the mentally ill in our community, not less. I've committed a huge chunk of my life to doing this, and I've built relationships with these people over the years. Unfortunately, it's not a profession that there's a lot of opportunities in this community. I would not want to leave Corpus, but I might have to. I have a son in high school. I'd like to see him be able to finish high school where he started. But it's more about our patients.
Okay. My name is Liza. I'm an RN here at CIBH. I worked outpatient with Dr. Perderio in his clinic for 3 years, and then after I got my nursing degree, I transitioned over to inpatient. My concerns about Memorial closing would be the fact that the geriatric patients that Dr. Perderio sees in our area would have nowhere to go. And in regards to my personal concerns, I wouldn't have a job. I feel like mental health is just as important as, your physical health.
All right. Hello, how y'all doing? My name is James Spears. I'm an MHT at Memorial Hospital Psych Unit, CIBH. I've been here for 19 years, going on 20. Memorial has been one of the best hospitals in Corpus Christi for a long time. We were the #1 ER unit here in South Texas. Y'all closed it down. Everything went crazy. Everybody went over, tried to go to Shoreline. Shoreline was all messed up. Spohn South was all messed up. Bay Area was messed up. When y'all closed this place too soon, everything in the whole city, the whole freaking city was messed up. We had people inside the emergency rooms waiting in line, sitting there waiting in the hallways to be seen for like 3 and 4 days because y'all closed everything too soon. My other concerns is with our patients. What are y'all gonna do with our patients? Because if y'all take us away, we don't have nowhere for our patients to go. Our patients don't have nowhere for them to go. Doctors Regional, Bayer, all those other places, they can't hold our capacity. We've been holding everything, and we've been one of the main money makers for a while for Christus Spohn. I don't understand why y'all would want to close us instead of help us get fix everything up so we can help take all of these folks out of the emergency rooms where they're going to go to and keep them or take care of them in a facility where they can be helped and get better. But they can't do that if they don't have any place to go. All they're going to be doing is in the streets, running around, and the cops are going to be having to deal with them, and they got enough on their plate right now to be trying to deal with our patients that we're supposed to be trying to deal with, and we can't even do it because y'all aren't helping us to get that taken care of like y'all supposed to. Personal concerns. Like I said, I've been here for 19 years. I've been sticking with this place, dealing with everything that's popped up and hasn't popped up, and hanging in because I love what I do. I enjoy working with folks. I enjoy taking care of folks, the indigent, everybody. I've worked from every unit in Christus Shoreline except the burn unit and the baby unit. Them are probably about the only 2 units in the hospitals that I have not worked on. I would like to keep this going. I would love for Christus or for y'all, anybody, to help Dr. Poderio so we can keep these places open because we need this. Our city needs this real bad. I know too many people out on the street that need help and can't get it or don't know how to go about getting it. But that is something that we all need to do. That's our job, is to take care of the older folks that can't take care of themselves and the indigent people that can't take care of themselves. That's our job. That's what we're supposed to do. Christus is supposed to be a Christian hospital, but I'm not seeing what y'all keep saying y'all are doing. Y'all holler y'all a Christian hospital. Why are y'all trying to close the place when we need to take care of these folks? Christian folks wouldn't turn their back on them. Christian folks would stick out their hand and help them out like y'all always tell us. So y'all need to please help us with this. We can't do this without y'all. And there ain't really too much else I can say that's not going to keep being redundant. And I don't want to be redundant. But please, we do need y'all help to take care of these folks in our city that can't take care of themselves and need our help. Okay? Hey, thank y'all. I appreciate everything, and thank y'all for listening to me.
I'm Valerie Alcorta. I'm a mental health evaluator. I've been in the psychiatric field for 8 years, since 2012. I've worked at various places. I've worked with both the psychiatric population and the substance abuse population, as well as the dual diagnosis population, which are individuals that have both psychiatric and substance abuse issues occurring at one time. That people that don't have a very good healthcare coverage as an insurance or a lot of money out of pocket are not going to receive the proper help they need, especially in stabilization purposes. It's hard enough to get a psychiatrist nowadays. Being in the field as a case manager, I would have clients waiting up to 4 to 5 months to see a psychiatrist at MHMR or MHID now. So if they're not stabilized properly, you're looking at suicides, you're looking at more depression within the community. And my personal concerns are people aren't really going to care about this when it comes to closing down psychiatric units until it happens to them, until they're the ones who are suffering, until they're the ones who are experiencing that depression where they need to be stabilized and then they can't get into a facility because of the beds. And that's sad because we have a over 350,000 people population, so how are up to 14 beds supposed to help? It's not. They're going to be at capacity. And the sad thing is we don't want somebody dying of depression and of suicide, of anxiety, of anything that could have been prevented.
My first name is Armando, and my last name is Garcia. And I've worked here at Spohn Memorial for many, many years with behavioral medicine. I've worked for 20 some odd years with behavioral medicine, about 4 years with security, and now I'm back with behavioral medicine. Is where you're gonna basically put all these people that need help with behavioral, mental, and abuse of alcohol, drugs, what have you, that want the help that they can't seek anywhere else. Now, the concern for the mentally ill is, are they gonna be lost in the cracks once again if this place is to close down? Because again, where can they go? Now, on a personal concern is that everybody here, well, I speak for myself, I'm sure I speak for everyone else, we need our jobs because we have bills to pay, we have people to feed, you understand where I'm going with this. Basically, that's all I have to say, and hopefully, they will not shut this place down and or find other place for this establishment to continue doing what they're doing and helping these people that need the help that they need instead of letting them fall through the cracks. That being said, thank you for your time, and I appreciate your listening.
Good morning, my name is Judy. I have been a nurse for over 9 years. I have been working mainly in the psychiatric population. I have been taking care of these patients over 9 years at least, knowing that this population deals with a lot of problems, lack of education, lack of support, health and mental problems, that consequently, if these people don't get the right help, they probably will end up in the legal system. So that is my concern about this population.
Hi, my name is Odelia Perez, and I'm an LVN, and I've been here with the psych unit for a short period of time. I started like 3 months ago, but I have a really big concern because we have a large community that there are patients out there that need. I have a concern for the mentally ill population. There's needs out there, and I feel that without us being here, these patients will actually get lost and forgotten and fall through the cracks and fall through the system. They are very Dr. Perderio being here is a great necessity for the Corpus Christi population and for the mental health and behavioral patients. A lot of us that are unemployed, and it's a great loss because there's nurses and techs and everybody's coming together to help these patients, and we're trained to do this, and it's a sad situation, and actually it will impact us financially. We're having the COVID-19 thing going on, so that also says there's many people that are unemployed, and they will also need a job. So we're all looking at the same time, and that's a big concern because I think some of us have a mortgage payments to make. I have a mortgage, I have a car payment, and we have to eat. So I just feel that closing the psych unit is not a good thing for Corpus Christi. It's very sad. And that's all I have to say. I hope that some way we could stay open, and I just hate seeing it be closed.
My name is Marina. I am the Psychiatric Evaluation Service Intake Coordinator here with CIBH. I have been here almost a year, and I have been in the mental health field going on 5 years. The community, I feel like it's going to directly affect the community in terms of the types of patients that we care for here are very difficult, and there's not going to be somewhere here in our community to treat them. And so I feel like it's directly going to have an effect on our policing here, and we're going to see an increase in crime and backup in our hospitals for patients that are going to be sitting there because there's not going to be a facility in our community to send them to get them the treatment that they need. And another thing that kind of hits home personally with me is for Nueces County to have a geriatric treatment center. I have both my grandparents that have been diagnosed with dementia and Alzheimer's, and I've seen that directly, and I've seen the effect that it's had on my grandmother and my other family members that have to really pull together and help, and not having that in our community is really scary because it's difficult to provide that kind of help and support and treatment for that type of population. And on a personal level, my concerns, of course, like I'm sure many others, are financial and employment, especially given the circumstances that we're in right now with all the COVID stuff going on. It's going to be difficult to find employment elsewhere and be able to provide for myself and my family. So definitely concerned about that there, and but I think really just it's sad that I think Nueces County has pushed in the last recent years to do a lot of provide outpatient mental health care, and that's great, and it's there to help, but not having an inpatient facility, I think, is going to be detrimental to Nueces County, given our population that we have here.
My name's Pamela Gomez. I'm a mental health technician. I have been working with this population for about 10 years. Is the elder patients that we see. I've been here for 2 years, so whenever I've seen many cases where they're living in their own field, then they don't understand that, they need help. They don't know how to ask for it because they don't know what's going on. So a lot of the demented patients that we have, they come in and we find placement for them. The counselors find placement for them, and it's a long-term placement. My concerns about the mental ill population is that we see a lot of the same patients coming in. If they don't have insurance, there's not going to be a place for them to go. Concerns is during this time there's a pandemic and there's going to be 150 people who aren't going to have jobs.
Hello, my name is Mary Chapman. I'm a mental health tech at Memorial, and my concerns about the mentally population is that it has always been needed from a young age to adulthood to adolescent. It keeps us probably from going to prison when we can just have a mental breakdown, and military people also need some kind of psychiatric PTSDs, and also mental health helps our bodies to function correctly. And my concern is that if we close down the mental health here, where are our other patients going to be going to when they can be treated here in this Corpus Christi, and instead of having to be going to another town, another state, or they can be treated here, that we can stay open. And my concern is, I've worked probably at least 10 years with mental health tech, Alzheimer's, dementia, children with extended care, and chemical dependency, and I would recommend that we stay open for those patients that do need mental health here in Nueces County, and continue their mental health here in Corpus Christi.
Hello, my name is Janie Almeida, and I've been a nurse in the psych department doing utilization review case management for 21 years, working under Dr. Praderio. We have been serving a community of people that have a great need for help with their mental health. They leave here and they are not taking their medications. Situations happen in their lives. They seek us. They come to us at a very desperate time. Suicidal, desperate. Some patients come here with overdoses because life is so difficult for them. But we are here for them. They come here, they stabilize, they're able to go back to their lives, and we provide them with lots of resources for them where to go. We provide them their medical care, we provide them food, shelter, medications, whatever it is they need. We have social services that help them with community resources. I have a deep concern for our population that there's not going to be available beds for them in the near future. And where will these poor people go? A lot of them are homeless. And when they are out in the community and experiencing psychosis, hallucinating, a danger to themselves and a danger to others, not because they want to, but because of their psychosis, they are not going to have a place to go. They're going to be put in jail. They're going to be a danger to others, and someone may hurt them. And it's just very concerning that there is not going to be a place for these poor people. They are the underserved. They are the homeless. They are the ones that no one looks at. We also have a population of elderly people. We also have a population of young people that are in their homes working, but situations arise. Things happen, and they need a place to go to be assessed, to be treated, to be medicated, to stabilize and return to normal lives. Myself rather, am very saddened that this population has been forgotten and not considered important. And as I said, I've worked here for 21 years, and we have seen many people that have come back, many people that have stabilized and never needed us again. Nonetheless, I have worked with Dr. Praderio for 21 years, a very dedicated psychiatrist with the utmost compassion and caring for the patients. Primarily, the patients here come first. As I said, I do utilization review and case management. We provide everything possible to get these patients what they need. We have been complimented by many insurance companies for what we do for our patients. And it saddens me that we will, in the near future, not be here and available to these patients. I thank you for listening, and I hope that you take this and consider an alternative option, that there may be beds available to our patients, not just 10 beds, and a number that will be able to accommodate all of our patients in our community. We also get patients that come from the nearby communities. So if we are gone, where will they all go? If you look around your neighborhoods, around the streets, you will see that your neighbors, your family members, have issues that require mental health treatment, where will they go? I ask you, where will they go? Thank you.
Hi, my name's Karen. I'm an RN with CIBH. I've been at CIBH for about 4 years, with psychiatric patients for about 5. My biggest concern with CIBH going away is the fact that I have watched medications when a patient walks in the door and they have lost either all reality in life, they're a mess, they're downcast, they're suicidal, they're seeing things, hearing voices, they're off their medications. I have watched from the minute they come in till they walk out that door, a totally different person. These medications work. If they don't have a place to go, they're either out on the streets, off their medications, and the one place they're gonna end up is in jail. That's it. That's the only other option that they would have. They're not gonna have their problems fixed. They're gonna be a danger to themselves. They're gonna be a danger to others. Geriatric patients come in, they're dealing with a different type of psychosis when you're dealing with dementia, Alzheimer's. They need medications tweaked, they need things, they're becoming violent in the nursing homes. Where are they gonna go? They have nowhere to go when they literally cannot function mentally in a situation or a place where they need to be able to kind of fit in and not be aggressive. I don't know where these people are going to go, and it's just terrifying to me, and upsetting to where these people would end up. There's no other options in this area or anywhere close for these people. We have homeless people that come in. We have people that have families, people that are just trying to survive, and this is a legitimate chemical imbalance that they need their medications. These medications can work for a long time and then all of a sudden not work. I tell the patients, this is your Lamborghini. This is, this instrument here, and it takes a lot to stay on top of it your whole life. You're gonna deal with these psych issues, bipolar, schizophrenia, your whole life. And you need to constantly stay on top of things when your medications stop working and you need them adjusted or changed. And if they have nowhere to go, they have nothing but to just fall apart. And that takes down their families, that takes down their children, everybody around them. So that's where I stand on this. Thank you.
My name is Marlon Chapman. I'm an MHT here at CIBH. I've been doing this now for 7-8 months. It's a wonderful job. I've been dealing with an uncle who's had mental health all my life, so I would hate for someone who needs mental health, who can't afford to get it, and we shut down and they can't be able to get any help somewhere. In the population here, it is really, really sad of how many people that we have out on the streets who just can't find the help. And that's my biggest concern about if we go ahead and close this memorial site down. My personal concerns, I don't really have any major concerns about work related, but it's just the ones that need help. That's my biggest concern.
My name is Valdivia Mihan, and I am a medical health tech here. And my concerns here is that if y'all close the facility, what's gonna happen with all the homeless that I see out there? Because I live in this neighborhood and I see a lot of homeless people. And when I first started working here, I wasn't sure what I was getting myself into until I started working here and I saw how they came in. They were disoriented, that you couldn't even have a conversation with them. But after a day, just took one day for the doctor to give them medicines because they were off, because they weren't taking their meds. And you were actually able to have a conversation, talk to them, and they're more calm and more rational. And I feel if y'all close this facility, a lot of people that normally don't get a chance to get help, or they're not gonna get help because the facility is going to be closed. So I'm asking you all to consider, we even have the elderly on the 7th floor. It could be your mom, it could be your dad, it could be your uncle or aunt. They get help here too. They come, like I said, you don't understand them at first. By the first, second day, they're very good because the doctors here are very, very good with what they do. So I would appreciate if you consider and helping the community and keeping this facility open because it's very well needed. And I pray that you all do keep this facility open because it is very needed. And that's all I have to say. Thank you.
My name is John Hill. I'm an MHT. I've been in this field for over 30 years. One of my concerns is when these people have no place to go, who will take care of them? The small bed units that's open supposedly to them is only gonna hold a few people. The other people, how would they get help? And my coworkers and myself, we all need our jobs. So what about employment for us? There are only a few of us that really knows and has experience with the different behaviors from the different behaviors that come from the illnesses of bipolar, depression, schizophrenia, along with the drug abusers who got dual diagnosis, and they can be really a handful at times. And people who don't know how to deal with these people are going to go through a bunch of frustration and upsetness. I would like to see a place for these people who can have the care that they need and receive the medicine that they need. I hate to see what would happen to these individuals if they don't receive the care that they need. Ultimately, they're gonna get incarcerated or possibly somebody kill them or they kill themselves. I don't see no good outcome as far as a healing from all the illnesses just like overnight. I've seen even with the care that they get, some still do comes to suicide, go back to drugs. I mean, it's an ongoing process. You got new people coming in every day. So what about those people who never had the help that they need? What are they gonna do with them? Or just leave them out there? It won't do them to get worse. I hope whoever really needs to see this, see it with an open heart as a humanitarian, and what we're gonna do about our people who can't take care of themselves.
My name is Frances. I'm a registered nurse. I work on the Gero Psych floor over here at CIBH. I have 22 years of nursing experience under my belt, and a year and a half of that most recently has been specifically here at CIBH on the Gero Psych and CSU units. I have some concerns about this psych facility closing. Number one, about the clientele that we serve, the people that we serve, the indigent, the homeless, the people that have nobody at all and they're living in the streets. Most of our patients come in on warrants, and because of a psychotic break out in the public, and they can't be treated in a jail, which is where they would go. They have to be treated in a hospital, and this is the facility that has been taking care of them. And if we're not here, where will they go? It'll be a vicious circle, and there'll be more and more and more. And with all this COVID-19 going on, and people being isolated for 2 months, 3 months in their homes. There's a lot of mental stress going on just with the regular general population that's not the psychiatric type people. And there's a lot of stresses, people out of work in so many areas that aren't the front line people. And our staff that we have here, if they want to continue working in psychiatric environment, they're going to have to go out of town to find employment elsewhere, or they'll have to change their careers. And it's very stressful. It's very stressful on all of us. There are plans in the making for a new facility that should be ready, up and running, that would accommodate this clientele in 1 year. 1 year from the end of our contract here. And I don't understand what the big deal is to stretch out our contract 1 more year. I don't think it's asking too much. It would benefit the whole community. And I don't see what the big deal is. It doesn't make any sense. We're in healthcare, we're in behavioral health. We're here to serve, not to serve people. And politics are getting in the way of being there to serve people and make people better. So, and I have concerns too, because then if this does close up, then I'm going to have to look for another job as well. And I don't know what my future has to hold for me. So it's very iffy and it's a very uncomfortable feeling.
Good afternoon. My name is Ray Chapa. I'm a recreation therapist here at Memorial. I've been here for 20 some years, 20 plus years as a matter of fact. My experience is providing recreational activities for the population that we serve, the general psych, the indigent and all. And I believe that we need to continue with these services. It's absolutely necessary for someone to provide services for these individuals. I feel that we provide a valuable service to the community as well as what's going on with psych closing. We cannot allow this to happen. This is a very important part of our community, and we need to continue to have this going on. Our population is too valuable to just toss them aside. We see them out in the streets every day, and we need to try to help them out. My personal concerns is that we're going to allow this to happen to our community. Let's keep it going.
Hi, my name is Connie Dilanilla. I'm a registered nurse. I've been working here for almost since 1972, when it was first Memorial, then it became Christus Spohn, and now CIBH. I feel sad to know that the behavioral service is closing down. I look forward working every day to be with this kind of patient, and I know they needed us. Without this hospital, we don't know what's going to happen to these patients. They might become a nuisance to the community as they're not getting any treatment. They might be stealing, homeless, doing more drugs. They might end in jail, which they're not going to get no treatment. Without us, they don't know where to go either. When the patient comes in, they're more disorientated. They don't know what's going on. And when they get treated and medicated and get treatment, it's very rewarding to see them getting better and to face their family and to go out there, either they're homeless or not. But they need this place to get better before they can get out there. If they end up in jail, they're not getting any treated. they will remain the same, very psychotic, schizophrenia, and very distraught and violent, and drug addicts and alcoholic. Thank you.
My name is Manuela. I am the behavioral counselor on the geriatric unit. As far as being on this unit, I've been here going roughly on 3 months, but in total, working with mentally ill population, I have about perhaps 3 years, going on 3 years of total experience. So far, the experience that I've received working with the population here, it's been a very unique experience, you know, especially with the geriatric patients. I don't really know that there's many other hospitals or agencies that work with the geriatric, but being that they're a very vulnerable population, I've liked the work that I've been doing here so far, and I think that they're, you know, very vulnerable, especially those that don't have a lot of support systems. As far as with the others, you know, working with the mentally ill population, those that are out on the streets, the homeless, they are also very much in the vulnerable, because I think a lot of them lack those underlying needs and support systems, and what we provide here is very important to them. Then as far as the way it's going to impact is, I think with the site closing, it's going to overflood either the jails, the ER departments, and a lot of times they don't know how to handle these type of patients, and I think it's important that there is somewhere available for them to go and continue having those needs met. My personal concerns are, of course, you know, being displaced without a job, but overall, I think, again, the experience that I've received here so far, it's been great. I've been learning a lot, and I think as the young clinician, it's important that I get a good, well-rounded experience with working with a lot of different populations, like the homeless, the geriatric, and just with the family as a whole. And I think it's important for me to gain that experience here. So that's my primary concerns.
Hi, my name is Olivia Perales, and I've been a mental health tech for 32 years. Psych unit, there is a lot of people out there that need our assistance at this point. Rather than uninsured or insured, it's in big demand. I've seen it throughout the years as growing up. We don't want this thing to go on like it was in the 70s, where people were all over the place, not knowing what to do, how to get assistance, where to go to get some assistance and get started back on their medication. The population is growing in mental health, and it has in the 32 years that I've been doing this. My personal concerns is why these people are not being suited with a psychiatric unit like CIBH had been doing for quite a few years. So I am asking that the psych unit not close due to the need in the society. Thank you so much.
Hi, my name is Terry Rodriguez. I'm the administrative assistant for David Barrera. I've been working with Dr. Perderio since the opening of the geropsych unit in 2005. My concern is about the city of Corpus Christi and the patients that we see within the city. If you just walk around, you see psych everywhere. You see these patients who need help. And by closing the hospital, they're not going to be able to get the help that they need. You know, traveling to other areas like San Antonio or the Valley is going to be very hard for them, which means they will end up with no help at all. So I'm very concerned about the adult staff that will be walking around Corpus and will be affecting all of us. The geropsych unit it's kind of my heart. These patients, that population is growing. You know, I'm in that age group that I'm probably gonna need that type of service at one day. So I really think that we need to keep both the adult and the geropsych unit here in Corpus. As for staff, we have a wonderful staff here that they all work as hard as they can to take care of these patients. And they really do need to be able to work and provide and be part of Corpus Christi. So I hope that your decision will be that we will continue to serve our mental health population, and that our staff will be able to keep their job. Thank you.
Hi, my name is Aaron. I've been working with CIBH for about a year, this month exactly. I do believe that, of course, mental health is just as important as medical help, especially now in this time. It's very important because people are kind of losing themselves during this time, and even young children are kind of not really knowing what to do. So I do believe that it's very, very essential for a psych ward for our community. I've been working in the medical field for a few years. I started out with phlebotomy, and I did that for about 3 years, and then I heard about Care Integrated Behavioral Health, which is actually the same company that I worked for as a phlebotomist. And so I've been working for the same company for a few years. And so, yeah, it is very important, not only for our mental health, but as well as our employees and staff who need this job, who have been working here for many years. It's a very hard time right now. A lot of people are without work, and this is what our lives depend on, is our job and our income to help, make a living and pay our bills and keep a roof over our head and feed ourselves. And for those who have families, children, it is very important.